If you have a nagging, aching pain on the outside of your hip and you'd like to get rid of it, then this video is for you. Hi, I'm Dr. Dave Candy, and in this video, I'll explain the most common cause of nagging, aching pain on the outside of your hip and some things you can do to help relieve it right away. Additionally, I'll help you learn some long-term strategies that you can use to keep the pain from coming back in the future. So let's jump in. When many patients go to the doctor with a complaint of outer hip pain, the doctor may press right over the hip bone there and say, "Does it hurt?" And the patient says, "Yes, it does." And automatically that patient commonly gets a diagnosis of hip bursitis. The bursa is a little fluid-filled sac over the outside of the hip that creates a friction barrier between the hip bone and the gluteal tendons that run over top of it. But most outer hip pain isn't actually caused by bursitis or inflammation of that bursa, but rather by the gluteal muscles or the gluteal tendons themselves. You can also get outer hip pain from the tensor fasciae lata, a little muscle that attaches into the IT band that runs over your outer hip and outer knee. But all of those are musculotendinous problems. And when you have a muscular problem, one great way to help relieve the pain is to put pressure on that muscle, particularly on knots or trigger points in the muscle. Now, you do want to take note that it is possible to have a tear of the gluteus medius and gluteus minimus tendons. And if that's the case, that is a more severe issue. That may be something that hurts all the time. If you put any force through the hip muscle, it creates a severe aggravating pain. But if you've got more of a nagging, aching type of pain in the hip, it's more likely that you have probably myofascial pain or a tendinopathy. And in that case, pressure points can help quite a bit. Now in the office, we'll often have someone lay on their side, locate the trigger points manually, and either put a gentle pressure through it with our hands or occasionally do dry needling. But if you're looking for solutions that you can use at home, using a tennis ball can be quite helpful. So you'll take a tennis ball like this and you'll put it right over the tender spot. And you don't want to put it right over the hip bone. So if you feel a hard bone right there, the muscles lie just above that. So you'll find the area right above that. They're kind of triangle-shaped muscles that fill this little space right here. And take the ball and put it over that area. Then lie down on your side. It does help to do this on the floor if at all possible, or another hard surface, so you can get some pressure from the floor pushing through the ball, pushing into your hip. Now if you lay really hard with all of your weight on those muscles, it's probably going to be quite tender even if you don't have a problem. In fact, even just laying here like this, it's a little bit tender, a little bit sore. So notice I'm propped up on my elbow here. I'm not laying all the way down like that. So find the area where you feel like it's the most tender, most sore, and then lay there for about 1.5 to 3 minutes. That's about how much time it takes to release a trigger point. Now the other area that may be involved is the tensor fasciae lata, which is just a little bit more in front on the hip. So if you locate this bump right here on the front of your hip, then locate the bump on the outside of the hip, and then put the tennis ball kind of midway between the two. Then you're going to want to lay just slightly more on your front than directly on your side. Find the area that it's sore, and then just lay there again for about 1.5 to 3 minutes. Now there are some other tools that you can use for this area. This is one area where I think a massage gun is also quite helpful. So the one that I have here is the X6 Pro. This one's from Bob and Brad. I tend to like this one because it has a metal head which reverberates and can get kind of deeper into the tissues. And these are kind of deep muscles. So to do this, you'll lay on your side and turn the gun on here. Then you just find the tender areas, again, not right on the hip bone. That's quite uncomfortable, so go just above the hip bone. And move around until you find the sore, tender areas. I would tend to say about 30 seconds with this. It usually doesn't take quite as long with a massage gun to get it to relax, but just use your judgment, see when it starts to feel better, and then move to the next spot. So this is kind of more on the tensor fasciae lata on the front part of the hip. So again, midway between the ASIS, or the bump on the front of the hip, and the actual hip bone itself. We'll hold for about 30 seconds there or so. So those were 2 quick tips to help take the pain away. Often after doing this, you may feel better almost immediately. But if you don't address the underlying root cause, the reason why the muscles started hurting in the first place, then they're very likely to come back once you start walking again. So to address that problem, we want to do a strengthening exercise to help with the muscle imbalance between your gluteal muscles and your tensor fasciae lata. Both of those muscles have the common role of balancing you on one leg when you're standing. The gluteal muscles tend to balance you on one leg, and particularly the posterior fibers, which are the ones that tend to get the weakest, are also external rotators of the hip. So they turn you out that way or turn your pelvis this way. The tensor fasciae lata and the anterior fibers of those muscles do just the opposite. They turn your hip into internal rotation, or they rotate your pelvis towards the leg that you're standing on. So you want to stand with your feet evenly spread underneath of you. And if we're going to stand on this leg, you want to shift your weight over onto this leg and kind of externally rotate your knee just a little bit. Turn the leg out, so you're creating external rotation at the hip here. Load weight onto this leg, and then slowly lift the other leg up off the ground. If you need to hold on to something for balance, you can. If you need to keep the other foot on the floor, you can do that as well. Just load weight over this leg, and as you're able to, gradually let pressure up. It's not so important that you're able to stand on one leg as much as it is that you're able to maintain that gluteal contraction without overusing the tensor fasciae lata. The tensor fasciae lata tends to be overactive. The gluteus medius and gluteus minimus on the whole tend to be underactive, particularly those posterior fibers. So again, externally rotate the hip, load weight out over that leg, slowly shift your weight and unload off of that other leg until you can get full weight onto this leg. You don't want to allow your knee to knock in, so once you're on that leg, make sure you're keeping that external rotation and then stand in balance. You also don't want to allow your pelvis to drop down like that as you're standing on one leg. So you want your hip externally rotated, belt level with the floor. Now, if you can do that, you may be ready to move on to some more advanced balance exercises. And you can check those out in this video up here. But before you do that, if you found this video helpful, make sure to give it a like and subscribe to our channel so you can get notified of our future videos. Thanks for watching, and I'll see you in the next video.